One subject that you and I have talked about over the years, Dr. Thomas, is the theory around environmental press.
Hmm.
And I'm wondering if you could give us kind of a big picture look at how you interpret that. And then maybe on a more micro level, we could talk a little bit about the Minka here at USI and
Sure.
maybe some of your other initiatives.
Okay. So I think that probably the most towering figure in developmental gerontology is a man no longer with us named M. Powell Lawton. And the reason he's so important to the history of our field is that he developed and refined a theory called environmental press. And what he understood really before anyone else was that the dominant cultural stereotype of older people was of weakness and loss, and the idea was that people who are experiencing those losses, that we should minimize the press, what he called the press of the environment, or how
Mhm.
challenging the environment they were living in was. And that really defined a lot of design work in terms of nursing homes and healthcare settings. And the whole idea was to make it less and demand less and less and less of people as their capacity became less and less. Well, Paul Lawton was like, that's a bad idea.
Mhm.
And he said, actually, we don't want minimum press. We don't want maximum press. We want optimum press. And he made a really powerful argument that living in a space that applies just the right amount of difficulty to the person helps that person protect and enhance their function and independence, actually.
Mhm.
So I certainly have been influenced by his insights, and I've really tried to frame the work that I'm involved in on helping people understand and optimize environmental press for people where they are, wherever they're living. And kind of the irony of it is sometimes that means making it harder to live in a place that's actually good.
Yeah,
Uh,
I think it's a good reminder for us, whether we're a healthcare professional, whether we're a family member, or whether we're an older adult ourselves. Pause for a minute. You may not need to remove from your environment, but maybe it's looking for that optimization that you described.
a good example that a lot of people have familiarity with is helping a young person learn to ride a bicycle. And not everybody, but a lot of people make use of training wheels on the bike. That's great. It's a way of reducing the press associated with learning to ride a bike. So I think that's a great idea. But just imagine if you never took the training wheels off. That person would never go to the next level of mastery of bicycle riding because you had artificially suppressed the environmental press through the use of the training wheels. So we can see similar things uh, in aging. In fact, I'll tell you, I was approached once out in Silicon Valley by by a scientist who was very excited to talk to me about his idea for making uh, a kind of a suit of armor for older people with motors in it so that it would move their arms and legs and they would be able to walk upstairs and jump and do all these things. He was like, wow, this would be so great for older people, then they could like do all these things they can't do now. And I was like, that is a really bad idea. It's
Mm,
like, how can it be a bad idea? They would be so strong. And
mm,
the answer is you're minimizing press. They're going to lose strength. They're going to lose balance skills. And without that machine, they're going to be far weaker than they would be without it. So, what I'm kind of getting at is we need to think about environmental press in every dimension. And last thing, if I may,
mhm.
just saying that people, there's also cognitive press, or how complex a cognitive environment is. And that also needs to be optimized for people with living with and not living with cognitive change.
Mm-hmm. Thinking about the environmental press, I think ties into how we give ourselves permission to receive to reach our full potential, and how we set up environments or orchestrate or be a part of partnering so environments allow people to reach their full potential,
No,
no matter their age, right?
no, and Katie, I just thought about you as a professor when you're making tests. If you make a test that is so easy, you don't have to come to class and don't have to read the book, you
Mm-hmm.
didn't help anybody. And if you make a test that's so hard that even the most diligent student working as hard as they can can't pass it, that's a terrible test.
Mm-hmm.
You do it all the time. You want to optimize the press represented by that examination. So that's what good teachers do.